Hello everyone. In this class, we'll learn about cardiac failure and also the effect of exercise on cardiovascular system. Cardiac failure can be defined as inability of heart to pump the blood in sufficient amount to meet the requirements of body. Some of the causes for cardiac failure are decreased coronary blood flow leading to decreased contractility, which can occur in myocardial infarction, valvular dysfunction, pericardial effusion, cardiomyopathies, and obstruction to the outflow as it occurs in case of hypertension or coarctation of aorta, and some nutritional deficiencies like uh, thiamine deficiency and beriberi. There are different types of cardiac failure. It can be systolic or forward failure, which occurs due to the weak pumping action of the ventricle. It can be diastolic or backward failure, which occurs due to the decreased filling of the ventricles. It can be high output failure, where in this type, although the absolute value of cardiac output is more than the normal, it cannot meet the requirements of the body. Compensatory mechanisms which can happen in cardiac failure. Baroreceptor mechanism. Cardiac failure leads to decreased pumping action of the heart. So cardiac output decreases and thus BP is decreased. This leads to activation of baroreceptors. The activation of baroreceptors leads to following changes. It leads to stimulation of the heart. This results in increased contractility. The stroke volume increases, heart rate increases. There is increase in the cardiac output results in increase in the blood pressure. There will be peripheral vasoconstriction. This leads to increase in the diastolic blood pressure. Peripheral venoconstriction leads to increase in the venous return, which increases the diastolic volume. Thus, the stroke volume increases, which increases the cardiac output. Adrenal medulla is a modified sympathetic ganglion and when stimulated leads to increased secretion of epinephrine and norepinephrine in the circulation. Epinephrine mainly acts on the heart and blood vessels. Decreased cardiac output leads to renal hypoxia. Renin-angiotensin mechanism is activated and this will lead to vasoconstriction. There will be increased retention of salt and water by the action of aldosterone. This leads to increase in the blood volume and thereby cardiac output increases. Effect of Frank-Starling's law. In early stages of cardiac failure, operation of Frank-Starling law helps in increasing cardiac output. That is, decreased cardiac output, there will be increased end diastolic volume that causes stretching of the myocardium. That increases the force of contraction according to Frank-Starling's law, which increases stroke volume and cardiac output. The effect of Laplace law. According to Laplace law, where pressure is directly proportional to the 2 times of tension divided by the radius, where the P is transmural pressure, that is pressure across the myocardium, T is tension of the wall and radius. Transmural pressure is responsible for pumping action, and when radius decreases, the pressure increases. So the pumping activity is increased, so stroke volume increases and cardiac output increases. Decompensated heart failure. In spite of compensatory mechanism, if heart fails to pump adequately the blood after venous return, it is called as decompensated heart failure. It can be right-sided or left-sided or both-sided heart failure. Coming to cardiovascular changes in exercise. Cardiovascular changes can be divided into changes that which occur in the heart and changes occurs in the peripheral circulatory system. Changes in the heart, these includes increase in the heart rate, cardiac output and coronary blood flow. Whereas peripheral circulatory changes includes changes in the systolic and diastolic blood pressure, blood vessels, and in skeletal muscles and capillary artery venous difference. Benefits of circulatory adjustments. Working muscles and heart are better fed and drained well. The better draining helps them to remove their extra heat. Increased quantity as well as velocity of blood to the tissue helps in better exchange of gases. Increased venous return happens because of increased physical work by muscles. So these are some of the changes that occur during the exercise. The heart rate uh, increases proportional to the severity of the exercise. But in trained athletes, the increase is less than that of untrained individuals. In healthy individuals, heart rate will not exceed more than 180 beats per minute. In advanced age, there is a less heart rate rise even with the same weightage of work done. And these changes occurs mainly because there is a fall in the vagal tone and a rise in the sympathetic activity, the adrenaline secreted in the early phase of exercise, and rise in the body temperature and in later phases, which mainly leads to tachycardia. If you see the cardiac output changes, the cardiac output increases tremendously during exercise. The normal untrained persons can increase cardiac output little over fourfold, and there will be and the well trained athlete can increase the output about six folds. Increase in the heart rate mostly with increase in the stroke volume together cause increase in the cardiac output that will be according to the Frank Starling's law. As the heart rate increases, there is a shortening of the diastole, that is less time for the cardiac inflow, but the venous return increases impressively, compensating the decrease in the diastole period. And in untrained person, in moderate exercise, stroke volume rises only mildly, that is around 10 to 30% during severe exercise. In this person, the stroke volume will rise further, but in trained athlete, the stroke volume rises sharply even in moderate exercise, and in severe exercise, it may be doubled. Coronary circulation increases with the heaviness of exercise. So this occurs because due to the local hypoxia of the myocardium, and the sympathetic also has some role in this, as they are more active through the beta receptors, which leads to uh, uh, cardiac coronary dilatation. Systolic systolic blood pressure usually uh, in moderate uh, isotonic exercise increases, and the systolic blood pressure depends more on cardiac output. As the cardiac output increases, blood pressure increases. Effect of vessels of skeletal muscles. There will be severe vasodilatation of the blood vessels occur during exercise. This may be due to the vasodilator effect of cholinergic sympathetic activity or due to the local metabolites and local hypoxia. The artery-venous difference is increased due to the increased oxygen extraction, as there will be raised coefficient of oxygen utilization from resting value of 4 ml per 100 ml to maximum of 16 ml per 100 ml. And this difference is mainly contributed to increase in the 2,3-DPG. According to the Bohr effect, this has to occur. So this is in brief about the changes that occur during exercise. Thank you.